I'm Danny Davis. My guest is Roger Briggs, founder of Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. Welcome, Roger.
It's good to be here. Thank you.
In this segment, we're discussing patients who have diabetes.
Yeah, diabetes is one of those things that it affects people because it's an inflammatory disease. It affects their ability to heal. It affects their ability to resist disease. And so periodontal disease in dentistry, that's one of the most common diseases known to mankind. And so it affects people with diabetes. Some of the current information that we're finding out about periodontal disease and diabetes is that if we can treat someone's periodontal disease many times without doing anything different than that, they can lower their blood sugars by 20 points. So if you're a diabetic and you get a free drop of 20 points, sometimes that can take you from a pre-diabetic condition back to a normal condition. Or it can keep you from maybe having to go into more difficult ways of controlling your diabetes if we can drop it by 20 points.
Your practice handles diabetic patients, and those patients sometimes need specialized care, right?
You know, of course, you've got to be concerned if they're not able to eat. Their blood sugars can get out of balance with their insulin balance. You know, like anybody else, when you're done doing dental treatment, sometimes you may not feel like eating. And so you need to be very, very aware of some of the dental procedures that you're doing that could cause a problem for a person being able to take on nourishment. Sometimes too, diabetic patients will come to the office and they were running behind and they didn't eat breakfast, and then they get there and they still took their insulin the way they always do. You have to be very aware of what kind of problems that can create for a diabetic and be able to deal with it quickly and without any complications.
With diabetes, other issues sometimes need to be considered. Am I correct?
Yeah, periodontal disease, you know, it's one of those things, it's been linked to strokes and heart attacks. You know, because it's an inflammatory disease, some dental offices now are starting to do some blood tests. C-reactive protein is one of those markers or an indicator that says you've got an inflammatory condition in your body. Well, periodontal disease is just exactly that. It's an inflammatory condition. And so oftentimes if we have a diabetic or even without diabetes, a severe periodontal disease, we'll measure the C-reactive protein, and then after we've treated the periodontal disease, we expect to see that return to normal. There's been occasions where that doesn't return to normal. Certainly we want to work with their doctor and inform their doctor of what we've done and what their C-reactive protein levels were. There's been some occasions where we've even found some other diseases, even cancers, in patients that may not have otherwise been diagnosed had we not treated their periodontal disease and monitored their C-reactive protein to make sure that their inflammatory conditions weren't lingering in their body.
Periodontal disease has been associated with a number of different health problems. Would it be safe to say that regular dental care can be a lifesaver?
You know, I think it was the Mayo brothers years ago. They were interested in all kinds of health things. They found that people who lost all their teeth by the time they were 50, they lived 10 years less than the average population. And so there's been lots of studies that show that people who keep optimal oral health have a longer lifespan and have less other morbidity problems than people who don't see a dentist on a regular basis. It's interesting, here in Arizona, you can go and look at statistics that the government keeps for us. Believe it or not, in Arizona, I think it's 43.2% of the population has not seen a dentist in the last 5 years.
My guest is Roger Briggs, founder of Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona.